Hello, this is Larry Battin with Source Media Group TV, and thanks for joining us again for another series in Finding a Local Expert. Today we've got a very special guest, Dr. George Merriman from Freedom of Obesity in Shreveport, Louisiana. Doctor, welcome to our program today.
Thanks for having me.
Dr. Merriman, what we'd like to do is just ask you a few questions. If somebody was looking for a bariatric surgeon and wanting to find the best source for someone in their local area, what would you recommend for someone looking online for a weight loss surgeon?
Well, I would assume just the basic Googling or internet engine searching, but ultimately once you find names in any particular region, there's going to be a fairly limited number, unless you're in a large metropolitan area. But for example, in our area in the Arklatex, there's only going to be a fairly limited number of choices, and it's going to be fairly straightforward to start winnowing down from there. The most common way I get patient referrals is frankly by word of mouth, and we kind of prefer that because an educated patient, a knowledgeable patient, is a much better resource and reference than anything else.
Absolutely, and certainly I know a lot of folks as well, once they even get a referral online from somebody, or let's say a referral word of mouth, a lot of times they do go online and check those as well. So those health grades, Google Plus, Angie's List, all certainly assist in the very basic referral, which is certainly one's inner circle.
Right. And they actually kind of, as you mentioned, they play into each other. You hear something, you read something on the internet, and you find out if you know someone who knows something, and then you research it on the internet. One thing I didn't mention is, and we as a professional society, the American Society of Metabolic and Bariatric Surgery, have worked very hard over the last decade to try and objectify some of this stuff through participation in certain organizations, certain business products, if you will. For example, with our cash, patients who have to pay out of their own pocket, we refer to them as cash-paying patients or self-funded patients. We have a product we include in that's a financial protection package for if, God forbid, a complication happened. It's a product called Bliss. Well, Bliss has been tracking complication data for a decade now, and that complication data is available. So there are objective criteria that a surgeon can be evaluated by, as well as subjective or word of mouth or internet reputation things.
Absolutely. Having a good board system, I can see, well, that's also a very great aid. Well, let me ask you something else, Doctor. What is your experience, and how long have you been in the bariatric field?
Well, actually, I've been exposed to bariatric surgery, or weight loss surgery as it was originally known, or obesity surgery. I've actually been exposed to it since my earliest training days when I started my training at UAB in 1983. The first meeting of the American Society, at that time they called it the American Society of Bariatric Surgery, was in 1983. There were 53 charter members of the society at that time. 2 of them happened to be faculty members at UAB where I trained. So like I said, I've been exposed to bariatric surgery, not from its infancy, but certainly from its young childhood, maybe young adulthood. And but I started in my own private practice in 1992 and have been doing bariatrics since about 1996.
Wonderful. So you performed a lot of surgery since that time?
Thousands.
Well, let me ask you, if there was a patient looking online or had someone referred to them, what kind of patient experience would they have coming in to chatting with you and then kind of going through the process of doing any type of weight loss surgery or treatment?
Well, I don't want to speak to some dogma or some everybody has to do it the same way. I only speak to how I do it. And around here, as I like to say, routinely, things go routinely. And I like to feel that's because of the way we do things. And number one is to have an educated consumer of this stuff, to have an educated patient. A well-educated patient doesn't guarantee success, but a poorly educated patient guarantees failure. And we are interested in good outcomes. And so I refer to patients when I talk to them is as I put them through their due diligence. I want them to learn just as much about the procedures and the technology that they know they're not interested in as much as the ones that they think they are, because the standard of care, the state of the art is always evolving. We don't want to burn bridges that we don't have to. We want to keep all our options on the table. We don't want to get stuck into one way of thinking. And so that would be my first. When looking at a website, if it looks like they're interested in me as a person, in me as a standalone entity, then I'm still interested. If they're just looking at me as a number, as the next case online, then I might not be as enthusiastic. So I would evaluate the websites based upon that. And then from there, the next most important thing is a program has to be multidisciplinary, the treatment program. It's way more than just the surgery. Morbid obesity, unfortunately, is a chronic, recurrent, relapsing, incurable disease. And if we're going to approach it head on, and honestly, we're going to approach it in that reality, meaning that the surgery is just the beginning of the treatment protocol, not the end of the treatment protocol. So what kind of follow-up regimen do they have? What kind of aftercare protocols do they have? For example, we have a private Facebook support group page for our patients to access, and we've found that to be of very high utility because you can't have standalone support groups. This is a complicated disease, and we can't have patients giving one another advice in an unmonitored kind of environment. The Facebook page has been revolutionary in our ability to evolve that process.
Well, doctor, that's some wonderful advice and also a good explanation on what a patient should expect this very difficult procedure that you go through. Well, if anyone would like any more information, you can see here at the bottom of the screen a phone number or website that you can definitely get hold of Dr. Merriman and his staff. So I can't thank Dr. you enough today, and we look forward to seeing everyone in another series here and finding a local expert.
Thank you.